was nice. Let's do that again. Good evening. Because that's what we're all about tonight. It's about community. I'm Patrick Jones, President and CEO here at Bucks County Community College. It's my pleasure to welcome you to your college. Community is in our name. Communities make us healthy. But let's think about community in multiple senses of the word. A community is a place where we live, and community is an arrangement, a relationship that we create. The research that guided this endeavor looked at communities around the world where people were living longer and healthier lives. I learned of this right as I was starting my job here, and I was so excited when the senator introduced me to the Blue Zones. I'd never heard of it. I went and I watched the Netflix series on it, and I thought, oh yeah, as the incoming president of this community college, this is really important. I've been honored to serve on the board of our Blue Zones initiative here. The senator asked me, I was so honored. I serve on the board of BCHIP. Kim invited me on to that Bucks County Health Improvement Partnership. I love that title, right? A partnership to improve health in Bucks County. So these two efforts together makes total sense. So how do we make sure that our community place that we live is truly fostering relationships that create a community that supports us for healthy living? Tonight we're going to learn more about that. So I'm so grateful that you've joined us this evening. I am so thankful to Senator Steve Sanacero for bringing this to our community and for bringing us together. I am so grateful to Kim Permar from the Bucks County Health Improvement Partnership for stepping up and saying, oh, BCHIP, maybe this is something that we should also be involved with. So with that, please welcome our state senator, Steve Sanacero.
Thank you, President Jones, and welcome all to this meeting this evening. I want to thank President Jones for his enthusiastic embrace of this program and this idea from the very start. As he said, I asked him to serve on our steering committee as we went forward with this project, and he was enthusiastic about doing so. This is not the first meeting we have hosted for this topic here in this room at the community college, and I'm grateful for the community college opening up this space. So thank you again, and thank you to Kim Permar and BCHIP. We have had a terrific partnership from the get-go with this idea of creating blue zones, or a blue zone here in Bucks County, and as you're going to hear tonight, that partnership is going to continue as we move forward to the next steps in actually implementing this here in our community. So I am Steve Sanacero, and it is my great pleasure to welcome you here tonight, and my honor, of course, to serve as your state senator, or at least probably for most of you, in Harrisburg. This is something that began a little over 2 years ago when I learned about the concept of blue zones, these 7 places throughout the world where on average people lived longer, healthier lives. And for me, what really was captivating about that from the beginning was not so much the live to 100 idea, although we all want to live a long life, but more living a healthy life, and beyond that, as President Jones just alluded to, also creating and fostering a better sense of community. And I think we're at a point in our existence right now in this world, largely due to technological changes that we've seen in the last 20 years that are going to accelerate and take humanity in all kinds of directions that we can't quite comprehend or foresee at the moment. The idea of bringing us all together as community to foster those bonds intergenerationally and throughout our area is more important now than it's ever been. And we're going to talk more about that in a bit. But the general program for this evening is as follows. I'm going to start with a little bit of background on how we got to where we are. Then Margaret Brown from the Blue Zones organization, who will be participating with us virtually, is going to go over the assessment that her organization did. And then we are going to talk about next steps. After Margaret is done with her presentation, we'll open it up to questions you might have of her. And then Kim and I will start to talk about what we see as the next steps, and we're going to have a discussion about that as well. My staff has asked me to make sure, and I'm going to remind you of this several times tonight, there are materials that were available when you were coming in. If you would, on the way out, please leave them on those tables. We have a limited number of them, but we wanted to make sure they were available for you tonight to take a look at those, okay? So I've done that public service announcement. I'll repeat it again later. The other public service announcement I will make is if you have one of these, please put it on silent mode. That would be great. I think the restrooms are off that way. We do have some refreshments. Feel free in the course of the evening, and we'll try to keep this to about an hour and a half. If you need to get up and use the restrooms or get a bottle of water or a bite to eat, that's fine. Just try not to inconvenience any of your neighbors, and that would be great. All right, let me start with where we have been. So back in the winter of 2024, I was able to secure a grant from the Commonwealth of Pennsylvania to fund what turned out to be an assessment of our community, at least that part of it that is in the 10th Senate District, which is a little over a third of Bucks County. Everything from Bristol Borough in the south, up through the Yardley Newtown area here, up to the Lumberville area, and then inland to Doylestown and New Britain. But I know there are folks here tonight who don't live in that area, some from outside of it, and that's great. We're glad that you're here, because you're going to hear what we want to do is really make this open to all of Bucks County, and frankly, for that matter, beyond. But the assessment was limited to what we were trying to do right here in the 10th District. And so we partnered with the Blue Zones organization, which created that Netflix special, which some of you may have seen. Just by a show of hands, how many of you have seen that? Okay, so very many of you in the room. And how many of you read the book about the Blue Zones? Okay, so this is a pretty well-educated group on this issue. So we reached out to them because we had no idea what it would involve to try to transform our area into a blue zone, because what really resonated with me at the end of that Netflix special was the fact that they were now trying to take these lessons from these special places in the world and export them to other parts of our country and elsewhere to try to recreate blue zones. So I thought, let's see if we can do that here. So we reached out to them. They explained the process to us, which involved doing a baseline assessment, and then from there, a proposal about what to do next. So I was able to get a grant from the Commonwealth of Pennsylvania to fund that assessment. Over this late spring and summer of 2024, and I think it's all up there on the slide, the Blue Zones folks came in to Bucks County. We worked with B-Chip.
Okay, we can merge
There's a lot of blue going on here tonight.
We might have just found a new name.
We're going to talk. Yeah, we're going to talk about that too, because we're going to have to work a little bit on that. But that's an issue for a little bit later. But we worked with B-Chip because early on we decided that we needed a partner on the ground who was already in the health and wellness space, which obviously B-Chip is. And we were able to partner with them, and actually our grant came in through B-Chip, and B-Chip was integral from the beginning in making this process work. So we had the Blue Zones folks come in, and over the course of that summer, they toured the area. They met a lot of stakeholders. We, at the same time, were reaching out to the municipalities and the school districts in the 10th District to talk to them to kind of gauge what their interest was, and there was a lot of positive feedback. And many of you were likely at the public meeting that we did right here at the community college this summer of 2024 to talk about this process. We did another public meeting down in Bristol Borough at the wharf right on the river, and we had a good turnout there as well. After all that, the folks at Blue Zones went to work. They gathered all the information that they had amassed from their visits here, from research that they did about this part of Bucks County, and ultimately came up with a very thorough assessment of the area. Basically, the demographics, the health issues, everything you could think of that would have to do with creating these types of healthier environments and more community-centered environments. And they produced that assessment in the late fall of 2024, and then our steering committee got together to review that and to talk about what the next steps ought to be. Now, I'm not going to talk about that at the moment because I don't want to put the cart before the horse. But that's where we were a little over a year ago, having now digested the assessment and started to think about what those next steps were going to be. We have, as I mentioned before, Margaret Brown, who I hope is on the line. Okay, she is.
I'm here.
Okay, Margaret. Hey, it's good to hear from you. I see you up in the corner there. Awesome. Can you hear me well, Margaret?
I can.
Okay, great, because when we get to the question and answer period for you, I might wind up repeating the questions so you can clearly hear them. But Margaret is going to go through what the results of that assessment were, and then we'll open up the floor to questions. Okay? So with that, Margaret Brown. Margaret?
Thank you so much, Senator. I want to thank you and BCHIP for the opportunity to partner with you on this process. It's been certainly a personal joy of mine to be in Bucks County as often as I was and to engage with you all and partner with you all as we went through this process. So thank you. For any of you in the room that I did not get to meet as part of this process, I just want to say, give you a little bit of background about myself. Margaret Brown. I am the VP of Development with Blue Zones. I've been there for 8 years. And in my career leading up to Blue Zones, I've spent many years focused on community health, public health, health systems, change within health systems. And so Blue Zones for me is really a personal purpose, mission. It drives me every day. And I am excited to share a little bit of that with you today. Next slide, please. So the purpose of Blue Zones is to empower everyone everywhere to live longer better. And we do that by focusing on the environment and lifestyle change as the focus in the first step out of the box versus individual will and focusing on individual behavior change. It's really about shaping communities that make the healthy choice the easier choice. This work, next slide please, is based on, next slide, is based on those principles from the original Blue Zones. I saw a lot of hands go up when we talked about the Netflix special. And those original principles, what we call the Power 9, you can go ahead and click through, I believe it fills in, are things like move naturally, eat wisely, purpose and downshifting and community connection. We take those Power 9 and we deploy those in what we call a life radius approach, focused on the places where we spend our time, such as schools and work sites and grocery stores and restaurants, the policy that's shaping those environments, as well as people and the programming and how those individuals come together. So during the assessment, these are the focus areas, and this is going to be how we report out on our findings, is through the people, places, policy lens. Next slide. The process for partnering with Blue Zones starts with this assessment period, roughly a 9-month period, a body of work with Bucks County in that partnership. It was just under a year that it took to kind of complete and deliver that report. And I will say you know, communities go through all kinds of iterations. So oftentimes we complete the assessment, and then it's up to community partners, leadership to decide how and when they want to implement these opportunities and best practices that Blue Zones brings forward in a recommendation. Sometimes that's in partnership with Blue Zones in a very formal way to bring the community to what we call a Blue Zone certification. Sometimes it takes a different path, and that's going to be up for discussion tonight. But I want to call out that this report that we're going to go through, this deliverable that we gave back to this community at the end of this assessment period, has an immense amount of utility, and it has an immense amount of clear direction on kind of where to go next to start shaping those environments, to start bringing people together, and start shaping how health and well-being can happen where you are. So next slide. So as the senator said, we focused on his senatorial district, around about 200,000 lives in that, 212, 875 in the adult population, roughly 270,000 if you include those under 18. But we look at the adult population because frankly, that's the place that we can gather data. We don't sample children, and most organizations don't. So we look at the adult population, but we focus on building environments that are helpful for all. So next slide. And a little bit I want to share on how we approach this assessment. One of the first things that we look at is the status of well-being today as reported by the people who live in the area. So we partner with a group, Gallup, you're probably familiar with them. They do a lot around political polling, but they also do a lot of other polling. And one of the polls that they have is around well-being. It's called the Well-Being Index. And when we looked at the central and lower Bucks County, which is essentially the senator's district, the state of Pennsylvania, and the nation, what you'll see there on these bars is that central and lower Bucks actually outperform, means they have a higher well-being score than both the nation and Pennsylvania as a whole. They would be ranked, Pennsylvania 34th out of 50 states, whereas Central and Lower Bucks is ranked 24th out of 154 best practice metropolitan statistical areas. However, when we go into kind of the elements of the well-being index, which include purpose, social, financial, community, and physical, there becomes some areas that we may want to focus on. And I would say these areas here that are green, even though they're in the second quintile, they're still areas that can bring a lot of improvement. Financial well-being was one that we heard a lot about while we were on site, the stress around managing finances and the affordability of living there. Sense of community and connection, that was a theme that came through over and over again. So this came through in the data, but it also came through in the qualitative interviews, the discussions that we had. And then this sense of physical well-being, there's opportunities there to get more people out and recreating in your beautiful environment, but also just more connected streets and active transit in and around the community. So next slide. And you can click through this to the next slide. Yeah, it's going. It's just building. So you can just go on through. There's a couple of transitions there. Thank you. Yeah. So when we break this down, this data, to what we call the word on the street, when people are responding to this data, what we found, or to the survey, what we found is 1 and 2, 50% reported not exercising at appropriate levels. 3 and 5 do not eat sufficient fruits and vegetables, are obese or overweight. 1 and 3, 30% are not proud of their community or have a poor sense of purpose. 2 and 5 experience daily stress or have worried about the money in the last week. So when you put it in that context, imagine, 5 of your friends. This breaks down to a very personal level. This is something that is happening within your community and opportunities to begin focusing how we work. Next slide. Part of using the Gallup Wellbeing Index, we're also able to look at where we stand on some of these modifiable behaviors. And what we found is for the Bucks area, compared to Pennsylvania, compared to those top performing MSAs in the nation, there are some opportunities to improve things like exercise. Clearly, people already said they were not exercising at appropriate levels. improve diets, reduce high blood pressure. If you look at that gray bar, you'll see that Bucks County, Bucks area is about a 61% higher than your best performing MSAs in terms of high blood pressure. High cholesterol, about 73% higher than the top performing MSAs. So there's a lot of opportunity there, and certainly some opportunity around tobacco, 117% higher than the best performing MSAs in terms of tobacco use. Next slide. When we look further at how those risk factors that we just saw express themselves in chronic disease, this is kind of the end point of some of those risk behaviors. You see a little bit elevation of cancer, depression, and diabetes. Those are directly linked back to some of those risk factors and some of the data that we saw around social connectivity, the sense of community, sense of purpose, exercise, and diet. Next slide. And when we just look at the 11 risk factors on their own, just the 11 risk factors for the Bucks area, what you begin to see is how this comes through. Perception of health. Almost 60% said they have a poor perception of their health. They don't feel as healthy as maybe they could. Another 57.1% on the nutrition. 50.2 said they don't exercise enough. So this gives you a sense of what the raw data is saying on those percentages. Next step, next slide. All right, so now we're going to talk about this readiness approach. So one way that we measure readiness, and this assessment is really both a readiness and a feasibility study. Readiness being, is the community bought in? Do they want to see this change in their community? And we measure that by, are we able to bring people together for this discussion? So in the keynote, the event that we held to just educate people about what Blue Zones is, we had over 180 participants. In dialogue, one-on-one conversations and focus groups with key leaders, understanding the systems that kind of move around Bucks County and make things happen. We had over 50 participants in those conversations. Over 100 individuals in individual focus groups. So these are really key metrics for us understanding where the readiness and the willingness is. But not just did they show up, but did they voice support for and want to move this project or this work in any expression forward in the district. Next slide, please. Here's how we scored. So we do apply a scoring rubric to this. On a scale of 1 to 5, we look at the leadership of the community. We look at the alignment to current initiatives, governing body support, your municipal and county government support, and then finally the last one, kind of the opportunity for well-being improvement. On a scale of 1 to 5, typically if a community scores between a 4 and a 5, we consider that very high readiness, that they are ready to move forward with some type of work, and you are going to have success because there's lots of alignment and lots of leadership support. Governing municipal governments and county governments are behind it, and the opportunity to make an impact is quite high. Additionally, into that, when we look at the opportunity for well-being improvement, we're also thinking about what is there the talent and the know-how and the organizations that can partner with us to make that happen, and we found that to be a clear readiness on that scale. Next slide. The additional thing that we look at from the scoring logic is what is the right mix of scope of Blue Zones work that we would recommend. So if a partnership were to move forward with the district and Blue Zones, we look at where this scoring fell. So if you are scoring at 3 or less, and we work in a lot of communities, oftentimes there's not this level of support. There's not this level of leadership alignment. We might recommend something like starting with schools only. And we've done a number of those projects where we're just starting with schools to build capacity to go beyond schools. When we talk about sector transformation, this is bringing smaller scale work, maybe focused on policy, maybe focused on people engagement, to help build capacity again. In any one of these starting points, there's an opportunity to go forward to certification. It just may take a little bit longer. But when we look at a 4 to 5 score, we really see the opportunity and the capacity to make change quite high. and we would recommend, moving forward with a full certified project, or at least the community moving forward with a very comprehensive approach to bringing this work to life within the community. Next slide. So now I'm going to go into a little bit more of what we learned. We're going to start with policy. We're going to talk about built environment first, and then we're going to talk about food policy. But one of the things that we look at when determining what is the right mix of policy, we ask ourselves, does the political leadership of the jurisdiction have the strong willingness to support our work? Is it aligned with their comprehensive plans? Have they been leading into or going in this direction for some time? Are the city's decision makers on board? Is there an opportunity to bring other community influencers in? And is there willingness to commit at this stage? Meaning they're saying, we want to be on board, we want to move forward with this. Next step, next slide. So in the built environment, and you can go straight to the next slide, some of the strengths that we recognize in Bucks County, I'm sorry, go back one. Some of the strengths that we recognize in Bucks County is this incredible natural beauty and recreation. I mean, I do travel the country, and I will say the Bucks area is some of the most beautiful landscape that there is. I mean, it's just incredibly gorgeous. You feel good just walking out into some of your parks. It's just breathtaking. You've got lots of recreational biking paths that you can get on. Downtown walkability within your boroughs and in the immediate downtowns of your small towns and boroughs, there's great walkability. There is wonderful parks and green spaces that are large for community gatherings, for having family picnics, any kinds of events that you want to host out there. It's quite wonderful for that. And then also you have wonderful civic gathering opportunities, events that bring people out and they participate, and there's an immense amount of pride in the area. So all of this is really good beacons for enhancing that built environment. Next slide. Some of the challenges that we heard a lot about, while you have really great parks and open spaces to get outside and be outdoors, there's not a lot that are directly connected to residential areas. Meaning, can you leave your neighborhood and get into a park relatively easy? Is it easy to get from your home to one of these parks without having to get in a car, load up everything like your bikes and drive them to the park? Could you just ride your bike to those spaces? And so we heard a lot about needing some greater connectivity. In some cases, when we were on the ground, even where there were some great recreation close to neighborhoods, oftentimes they were across busy roadways and was really kind of a pedestrian accident waiting to happen for folks to get on their bikes or to walk to enjoy those spaces. Biking is a recreation, it's not a function. It doesn't active transit. Some of your boroughs are relatively close together where biking should be relatively easy to get around as an easy choice. Maybe not year round, but certainly in the seasons where you don't have snow and ice, biking could be something of active transit. There is a little bit of generational housing crisis. We heard a lot about this when we were on site, where the affordability is eroding for young professionals that may move into your area. To think about teachers, nurses, your fire and police services, that middle area, that these folks cannot move in and really live in the area without a substantial cost to them. And then there's some limited reach of the downtowns, meaning there is some limited, when you get out beyond the small towns, there's some limited ability to have that impact beyond those downtowns. And some of these areas are quite segregated and not connected, or policy leaders aren't working close together to bring some of that connection. So those are the challenges that we observed. I'm not going to read all of the top policy opportunities. I'm going to highlight and go through a few, and I do encourage you all to go on the website, look at this full report. But let's click to the next slide. The next thing we want to highlight is some of the opportunities that we highlighted. One of them was to adopt and implement complete street approaches and policies countywide. Next slide, please. And the way that this can work is that in alignment with this wonderful visioning plan that you have, the Bucks 2440 visioning plan, is to really take that and enact complete streets approaches across the entire county so that it becomes more focused on the people and not just cars. So how do we enact policies that help people be more pedestrian-friendly environments, more bike-friendly environments? And some of that is through traffic calming, lane reductions, and really complete and maintain streets. Some, tree improvements, tree plantings, and things like that that make it more visually appealing and draw people out to want to be more of an active transit environment. Next slide. One of the other things that we highlighted, if you can click through to, is to support and expand the role of public gathering spaces. One of the opportunities that we saw was to create more what we call third spaces in your boroughs and surrounding your boroughs and in your small towns. Next slide, please. And the way that this would work is really thinking about small neighborhood parks and creating the opportunity to draw people in so that they might just accidentally bump into someone new, build new relationships, really creating those third spaces where people can interact. Maybe considering things like reclaiming streets that can be gathering spaces, such as permanent pedestrian plazas that offer a great opportunity for social connectedness, local businesses, and walkability. Think about school properties as having what we call shared use agreements, so that when school is out for the day, those properties be used for more walking, physical activity, and they're already there. We create functional spaces out of that. And these third spaces can also be repurposed vacant storefronts or commercial properties that we can create more smaller civic social uses so they're not just standing there open. Next slide. When we looked at the food systems, there's really incredible strengths in the food systems. Primarily, you have a great history and heritage that are celebrated through food. People come together around food. There is an abundance of healthy food available and is in high demand. You have wonderful farmers markets and farm stands with fresh local produce. And I would say that people genuinely care about their community through food and caring for food. The number of school gardens that you have and other types of community gardens are just quite rich, and the volunteerism that happens there is wonderful. You have a great hunger and nutrition coalition that is meeting the everyday needs of that kind of safety net provider around food to make sure no one is going hungry. You have the Bucks County Health Improvement Partnership that is providing essential leadership, helping with those community health needs assessments and bringing resources to help build improvement plans. And ultimately, you also have civic institutions that are really the heart of the community and helping to drive and support this work. Next slide. Here are the challenges. I'm not going to read through all of them. I just want to call out that some of this is around affordability of food, expanding the hunger network and bringing more policy alignment, getting more young people involved as the challenges that they're facing are quite high, and that there's opportunities to increase the hunger relief infrastructure. One of the things that we highlighted as an opportunity, and this is one that is becoming even more prevalent today. When we reported out on this a year ago, we actually did not think of this as food as medicine, or we didn't really name it that, but the opportunity that we highlighted is for the healthcare system's leadership to lean in and start supporting diet-related chronic disease outcomes. We now think of that, and it's becoming ever popular, as a food as medicine approach. Next slide. But, a conservative way to start is bringing the health systems in to support the hunger relief infrastructure. But also, we can think of this also as a healthcare system becoming directly involved through things like lifestyle medicine, food as medicine approaches, where at the patient's bedside in the clinical exam room, you're able to make recommendations and referrals and prescriptions for healthy food to help manage chronic disease, and making sure that your patients are directly connected to that and you have the resource and the partnership to turn that on. This is probably, if you do anything around chronic disease and managing that within your community, this is one of those that I would put a gold star on, and not to mention all of the funding that's becoming available to support these kinds of efforts. It really makes it a win-win for everyone. Next slide. I want to touch quickly on alcohol policy. There's quite a lot going on there in terms of how the Bucks County is managing alcohol in the area. There's a lot of supportive and active recovery. There's actually a lot happening around scanning and preventing youth from having access and underage drinking. There's a lot that's going on in terms of there's a comprehensive vision for incorporating health and wellness into the recovery aspect and decreasing the number of events that where you're focused on alcohol versus just connection. There's lots of support and services available. Next slide. But some of the challenges that are persistent within Bucks County is this mental health and stress. We already talked about it tied to finances, but there's also a high stress relative to many other things happening in the community. There's also still, even though there has been some things afoot to curb youth alcohol usage and access, there still is an issue around that. There is some excessive drinking around the adult population. And so one of the top level recommendations that we have here is cultivating the alternative alcohol-free gathering spaces and putting an emphasis even beyond what's already there on bringing people together and not making alcohol the cornerstone, but really putting the emphasis on other factors that can bring people together in a healthy environment. Next slide, please. And the way that we can work that is just getting with partners and promoting these events. You know, there's lots of cool things that are happening now. I would say even since we were in Bucks County, you see this happening more and more, this kind of mocktail gathering, coffee happy hours, all kinds of other alternative ways of bringing people together. And I would say even more so now, it's in demand. There's actually a demand for this, especially from younger, the younger than I am for sure. But this more and more of this is trending upwards, and alcohol use is going down. So the more that we can do this is going to incentivize more people coming together, and I think a lot more community gathering. Next slide. Tobacco and vaping. I would say that, you know, we heard a lot there around this tobacco issue, and it's something that Bucks County itself has been really focused on. There's really a comprehensive vision around addressing tobacco. You've got great policies within your schools. You've got a number of great cessation services that are happening. You've got a lot of tobacco-free spaces. But sometimes what is happening is you have some adjacent counties and adjacent districts beyond Bucks County that are making it all too easy for your youth and others to maintain that habit. And there's some opportunities there to reduce it. Next slide. And so some of that is listed here in these challenges. I would say one of them is the exclusion of vaping from the Clean Indoor Act that allows for more of that vaping to slide by, and it really does compromise public health and increase youth vaping. And so one of the things that we looked at is really exploring zoning regulations to address tobacco retailers that can help put a downturn on that vaping and access to tobacco products, and looking at that retailer density to just make it not so easy to find those outlets as they are today. Next slide. And I'm going to go through some of these next ones kind of quickly. So whoever's tapping, we're just going to keep going. Let's go ahead and go on to the next section because I don't want to go over my time, and I think I'm getting close to that already. When we looked at places, I'm just going to call out here, we looked at schools. There's a number of challenges within the school district. While schools are overall doing things pretty well to the best of their ability, they are short-staffed. Schools are being asked to do everything. They're being asked to write their own community kind of health plans and building out councils. And even though the wellness councils have been something that's been enacted probably since about 2012, I would say they've been kind of a checkbox, more or less. Some schools do it better than others, but there's really an opportunity to utilize that existing framework to bring in some of these best practices to those wellness councils, recruit the right leadership on there, engage your youth, especially high school youth, to be more active participants in that, to help drive overall engagement with your schools and bring some of these strategies directly into the school building level. And then designating, you know, with Blue Zones, we bring a full-time FTE to this work. If you're going to do this as a community-led initiative, you want to designate a person that's fully responsible for partnering with the schools So you're not putting it on the backs of schools to figure out for themselves. Next slide, please. When we looked at work sites, I would say, and continue clicking through, one of the things with work sites is in Bucks County, you have pretty diverse economic sectors, which is a good thing. You have a lot of entrepreneurial and small business areas, and they brought their support. You have a great strategic location located not only not far from your major metropolitan areas and to DC and to easy access to New York. And you also have strong tourism and recreation businesses. However, the challenges remain, being able to recruit and retain and acquire quality staff in your areas such as EMS, police, city, schools. And part of that is the attainable housing of the workforce. Where are they going to live? What are we asking them to do to commute, to service our communities? And so there's also not kind of a governing body that's pulling these work sites together to help drive well-being and improvement into those work sites directly. So one of the highlighted challenges here is that we recommend a intermunicipal, intergovernmental agency to kind of help partner with the local health systems and BCHIP to help provide health screenings, education, kind of joint wellness challenges across these work sites to really engage them in helping to improve their work sites and drive down costs for their workforce, but also to help make them a desired place for people to work and a workplace of choice. Next slide. Restaurants, let's just go through these pretty quickly. You have phenomenal restaurants, great farm to table focus, on-site gardens. I would say the rising cost and inflation, those have continued to go up since we were on site. And because of that inflation, you have declining customer spending. And not every restaurant is offering healthy choices equally. Some of the restaurants that have the best healthy choices are a little more expensive. And so making it hard on some of those young families to actually enjoy a healthy meal out. So our top opportunity here was to implement healthy options with those restaurants to help bring things, that are pretty cost neutral, like beans and legumes and protein-rich centerpiece dishes, using those beans and legumes that can help bring down the total cost, but also increase the desire for healthy food in a way that people can attain. Training staff knowledgeably how to discuss these healthy options to make them more appealing is important. And then implementing a rewards program to help offer points and discounts for choosing healthy options on the menu. Next slide. Grocery stores, we did meet with several of your more locally owned grocery stores. I remember having really great conversations there, a willingness to partner. You have a pretty diverse grocery landscape, pretty robust food assistance. But I think there's an opportunity to build on that food assistance, increasing SNAP utilization, double up food bucks, doing more work to bring farmers markets, maybe some CSA, community supported agriculture, boxes and delivery to those who need it most, and making it more of an equitable enterprise that people of all price points and all sizes can actually access those opportunities. And sometimes it takes a little bit of screening and getting people focused and getting them onboarded. Now, I am saying this, and I know I'm fully aware that earlier this year, we had a disruption in SNAP. The program is not going away. Even though the current administration is offering some challenges to that, I do believe that you're going to see this rebound. And in the meantime, we have to focus on getting more people plugged into this and utilizing those benefits. And in Bucks County, there's certainly an opportunity to extend that and enhance it even further. Next slide. Finally, we're going to end on people. On the community engagement, like I said, we had really wonderful engagement. People came out. We had wonderful opportunities to meet with civic and faith-based organizations. We heard a lot about the role that churches play. We heard a lot about the willingness to kind of support some of these gatherings and alternative types of events and bringing people together in what we call MOIs and walking groups and cooking classes, those kinds of things. Next slide. one of the key opportunities was to really create kind of a multi-generational connection so that you have young people connecting with older people through MOI groups and family networks. There's also an opportunity to host town and hall forums and community discussions using a structured dialogue to kind of break down some of the divisiveness and bring people together. I would say coordinating social media campaigns around highlighting local volunteer efforts. We heard a lot about, if you move to Bucks County, it can be hard to find where you should go to volunteer. How do you plug in? How do you engage? So there's really a good opportunity amongst those organizations to coordinate their communications, kind of stack hands, and have a unified message. Next slide. And that's kind of a rough overview. The report has so much more information. I highly, highly encourage you to go to the website, download the report, read more, engage with the senator and BCHIP as they're putting together some discussions around what next steps are and how they're going to move this forward. I want to thank you for your time. We are going to now open it to questions. And Senator, I will put myself on mute while you begin to entertain questions, and if you want to direct some my way, just let me know.
That's great, Margaret. Thank you very much. That was a whirlwind of information that happened very quickly, and I know, we, as Margaret said, a lot of it is on the website, but we wanted to give you an overview for tonight's purposes at least. Before we then get into the next part of our presentation, which is really about the future, we thought we'd open it up to questions you might have for what Margaret just discussed. So with that, we have both Rose on this side and Beth on that side with microphones. So if you raise your hand and want to be recognized, I will ask that one of them come to you. Are there any questions for Margaret? Right, over here. Yep.
So, how difficult is it within the different townships to get more bike lanes?
Okay, that's not so much a question for Margaret. Margaret, the question was, that's all right, how difficult it is within the townships to get more bike lanes. Can we hold on that? Because that really goes to what we're going to talk about for future steps. So I'll be happy to address that at that point. Yes.
I'm just curious how many other communities you've done assessments for in the country or in the state.
Margaret, did you hear that?
I did hear that.
Okay.
Well, I've been with Blue Zones for 8 years. I've probably done several hundred assessments personally. We have a pretty, sizable team that is doing this work with me. I would say on average every year we do probably 15 assessments a year. Currently, that's our current rate. That's kind of ramped up over the years. And of that, roughly probably 30% will move forward to some level of project work. And I don't say that to be a Debbie Downer, but there's a lot that goes into making this decision to move forward. There has to be partnership to make the investment. There has to be community will and the ability to overcome some of the hurdles to getting this work going. And sometimes communities may not move forward in year one, the year that we do the assessment, but oftentimes we will partner with communities down the road when they've built the level of support and funding and resource to move that forward. So eventually we do end up partnering with probably closer to about 80% of communities in some form or fashion. It may be supporting policy initiatives, it may be supporting schools work, it may be supporting just a continued assessment, but generally there's a continued partnership there. So I hope that answers your question.
Any other questions from, yes, sorry.
So one of the choices you gave us was about grocery stores and food sourcing areas. What type of policy changes would you, the fact is that these stores profit from selling unhealthy food. So what are the possible policy areas where you suggest can change that dynamic where these stores can actually profit from selling healthy food?
Yes, that is a great question. So on one hand, you have to focus on the systems of food that are around where those grocery stores are and how easy it is for those grocery stores to lean into local, regional sourced foods to put in their grocery stores. That's not always easy. Sometimes producers are not producing enough that they can actually have a viable marketplace within a grocery store. So from a policy, this is kind of a soft P policy. We have to partner with those grocery stores, the farmers, the producers, to begin ramping that up and making it possible to make those items available where you are. From a place-based approach, we also work on changing the choice architecture from the moment you walk in the grocery store. How do we highlight the healthier options, put them up front, nudge people towards the foods that they should be looking, put appetizing samples and recipes up front that they can lean into, and that takes another partnership with the grocery store. And I will say, yes, your grocery stores may not be perfect, but I will say those grocery stores in your area did raise their hands and say, we would like to partner with this. Wegmans, I believe is there, is one that we've partnered with in the past. They've been excellent. And some of your smaller, more locally based markets also said they would be willing to lean in and do that. So it's both a soft key policy approach, it's a systems approach, but the two have to come together to make that possible.
Okay, thank you, Margaret. If there are no further questions from there are. Okay, yes.
Thank you, Margaret, for your presentation and for the work. My name is Rami. I have a question about the assessment that was done and then about the link between the assessment and the recommendations for action. Was the assessment based on self-report, blood pressure, diabetes, overweight and obesity, whole range of things that you assessed? Was that all self-report, or was there some kind of objective measurement component? And was there a sampling methodology that gives confidence that can be generalized to our community as a whole? You said the population about 200,000 adults, and the number of people you talk to is relatively small. So that would be helpful to understand. The other thing around the methodology is I wanted to ask about heterogeneity.
Before you get to that, let me just make sure she heard that. Did you hear everything that? Yes, okay.
I did hear that. So I want to be clear on one thing. So two components of the assessment. One is the qualitative approach where we had discussions with kind of frontline leaders working in these systems and got their input to understand the kind of status quo of these systems today. That's where you saw the number of people that we talked to. The other side of this assessment is looking at the Gallup Wellbeing Index. The Gallup polling organization, has been gathering data since 2008. They have oversampled nearly every community across the United States. I say nearly because there's some very rural areas for which they do not have data. But for the Bucks County area, we actually had quite a high number, and I don't have that number in front of me right now, but the sample size for those that completed the Gallup Wellbeing Survey was quite high, and that is a self-reported survey. These are individuals across the community that are responding to the survey to Gallup and saying, this is how I feel about my health, these are the diagnoses that I have, this is how often I exercise, this is what I eat, this is how I feel about purpose and how connected I feel to my community. Just for a follow-up, Senator, I'm happy to try to, I'll go back into our reporting and pull out those numbers. And when Gallup produces that data, they do look at representation of the population based on what are the demographics of the full scope and area that we're focused on, and looking at the survey responses, and they do weighting and adjusting to the data so that we don't have an outsized portion of the community overrepresented in the reporting of that. Happy to share more on how that happens, and we have some resources, but those are two components of the assessment that we bring together to produce this kind of report.
Thank you. Just extending on that a little bit, I'm just going to guess that there's a lot of heterogeneity within this area. The issues that are most likely to be impactful in Levittown might be different from in Doylestown. Do you have the ability to look at the sort of heterogeneity of our region and prioritize interventions based on the specific area in which they're being recommended?
Absolutely, and I think if you look at the report and you read the details, you'll see where we called out what may work in the lower Bucks County area is completely different than what is needed in central and upper Bucks. It is not a one size fits all. While I highlighted some of the top opportunities, there are much more specificity in the report. And when we start a project, if you're doing that in partnership with Blue Zones, we actually bring Gallup in and ask them to do another oversample going very much deeper into the zip codes, the census tract level of collecting data so that we can explicitly call out the strategies that need to differ between those areas. And sometimes it's even within the same zip code that we need to employ different, on a neighborhood level, different strategies. So we try to balance that in our approach forward. And if we were to be involved in the next steps, we certainly would do that work.
Okay. I'm going to suggest that we move on at this point, only because it's almost 8 o'clock, and I do want to give enough time for us to have a discussion about steps moving forward. So, Margaret, I want to thank you for your work and everything that the Blue Zones organization did for the presentation tonight. It's really been a pleasure working with all of you, and I want to thank you. I hope this has been, for all of you, helpful to get a sense
Well,
of
this has been
work.
fantastic, and I appreciate your time and for inviting me in. I wish I could have been there in person, but thank you, and I hope you all have a great night.
All right. Thank you, Margaret. Take care.
Thank you. Thank you.
Okay, now we are going to move on to the next steps. And for that, I'm going to begin by introducing Kim Permar, who we referenced earlier, who is the Executive Director of BCHIP and our partner in this effort. And Kim is going to talk about a little bit of overview of the proposals that were made and some of the funding issues and how that leads to our next steps.
So hello, everyone. It is a pleasure to be with all of you tonight, and I really appreciate so many of you coming out to learn about the results of the Blue Zones study and what we plan to do next. I'm hoping that we'll keep all of you engaged after tonight. What I will tell you is BCHIP has been really proud to be part of this initiative in that we've taken so many resources that we have here in Bucks County already. You heard Margaret referring to the Bucks 2040 assessment that was included in this work. Our county has been very progressive in doing some of that work and looking at what some of the needs are across the county. We also have our health systems that do their community health needs assessments. They were incorporated into some of this work. We also have the additional resources that Blue Zones brought to this study. And then, of course, the financial support we were able to receive from the state. And so when we did this assessment, I can tell you that it is the most comprehensive assessment that I've been a part of here in all of my efforts here in Bucks County. And so I think we have some great data and some great opportunities that have been identified. The challenge became next steps. So when Blue Zones came out and shared the results with us, we are thrilled to have the results of this work. And they gave us multiple proposals on what could be next for Bucks County here as a Blue Zone. But in all fairness, they are quite expensive proposals. And so what we are hoping that we could do, and the Senator's going to elaborate on this a little bit more, but we want to bring this work forward, but we are not in a position at this time, and that doesn't mean forever, but we are not in a position at this time in our community to bring this work forward as an official Blue Zone project. And while that may be disappointing, I think that it's actually encouraging because I think we have so many resources here already that I think we're going to be able to have an impact and make a difference with the study and really bring some of this work forward just based on your response here tonight. And so I can tell you that in other parts of the country, some of the health systems have really leaned into this work. And if you are not already familiar, first of all, if you're not familiar with what BCHIP is, in full disclosure, my board is made up of the 6 hospital CEOs here in Bucks County, as well as many other members of the community. And BCHIP is a partnership that was designed to address gaps in healthcare and to address those gaps collaboratively across the county. And so we did bring in our BCHIP board of directors to this conversation, and they really are enthused about the work of Blue Zones. They really appreciate the assessment. They are committed to the health and well-being of this community. However, if you are not already familiar in southeastern Pennsylvania, our hospitals are not making a profit. If you don't know that already, I'm happy for you to go on and search that, but they are not making a profit. They are lucky to be breaking even here in Bucks County, or if not, they are actually operating at a deficit right now, okay? There's multiple reasons for that, and we don't have the time for me to elaborate on that tonight. But in asking them for lots of money for this project, it just really wasn't a reasonable ask. We are a very affluent county with lots of resources. And quite frankly, what we need to do a better job of is bringing those resources together. And so that's where I see the next steps are going to be for this work. We need to be a little more intentional about using the resources we have. We have other gaps in our community. We have gaps in our community related to behavioral health, that our county is actually doing an incredible job standing up some resources right now. If you're not familiar, they just launched a DART program for people with mental health that are engaged with the justice system and avoiding that problem. We also are doing some good work related to the Bright Path Center and opening that up for crisis. We have some big lifts here in Bucks County that we need funding and resources for. And I look at Blue Zones as a primary prevention for all of that. So it's a piece of the puzzle, but it can't be the only piece. And so our health systems agreed. And so the senator and I have met with health systems. We've met with lots of other folks throughout our community. We've met with our insurance companies. We've met with private funders. And Bucks County is unique in that we don't have, a baseball team, kind of like the Trenton Thunder here in Bucks County, right? That's going to come out and throw millions of dollars at this project. And that's what we were looking at. If I'm honest, we were looking at millions of dollars that was requested for this project. And so what we are proposing to do next is to bring this project forward at the most local level. And I don't want to steal Steve's thunder here to give you those details. But what I want you to know is that the health systems here in Bucks County are committed to this work and bringing it forward through their employees, bringing it forward through their community health departments. But even after a year, we were not able to secure the funding to move forward at this time with an official Blue Zones project. That being said, both Steve and I are very committed to taking the money that we've spent and making sure it is well used, and to take this assessment and bring it forward at the most local level using our townships and municipalities. So that's where we are looking to move forward. That's what we are thinking next steps will be, and we are hoping that all of you here in the room are going to help us do that. We're going to talk more about the details of that, but I'm going to let Steve kind of chime in a little bit first.
Thanks, Kim. Okay. So we went through that process. They gave us the proposal. The proposal was very, very expensive. And it was a good proposal, but as Kim just alluded to, we could not get the local funding. Neither Kim nor I thought it was acceptable to simply say, okay, that's it. We're not going to do anything further with this. And so we have met and we've spoken about what we should do to move this forward. Now, it's not going to be through the Blue Zones organization. So we can't use the words Blue Zones. So one of the things we're going to be working on, and we'll ask you for your input, not here tonight, but in the coming weeks and months, for basically what we can call this. It's got to be something that's going to grab the public's attention. It's got to be something that resonates. You're here tonight because the brand means something to you, right? You've heard about these areas of the world. So we're going to work on that piece as well. But what we decided we would do is, partnering with BCHIP, we are going to create within BCHIP a new committee or council that will probably be made up of about 10 to 15 people. And that council would be responsible for implementing this program any place in Bucks County where a community has an interest. And I'm hoping at the end of the day, that's going to be all of the communities of Bucks County. But we're going to start with the places where we have the greatest amount of interest. We hope to be in a position through grants that we'll be able to retain an executive director, someone who will be paid staff to help do some of the oversight that Margaret was just talking about. But then the next piece of this is going to be going to our municipalities. And I'm going to ask right now for my staff to, while I'm still talking, if you would hand out the Post-it notes to folks, because we're going to be asking before you leave tonight to get some feedback and ideas that you might have. And you'll notice when you came in, there were posters set up on easels. When you're going out, you can take those Post-it notes and put them up there. That would be great. how many, and I know I've seen a number of you here tonight, how many folks in this room, if you would just stand, who are local elected officials, either school board, supervisors, councils, stand up. How many of you? Okay, great. So we have some folks here, and I know we've had others in the past as well. I mentioned at the beginning of this project 2 years ago, we talked to every school district and we talked to every municipality, and frankly, all the municipalities in my district, save one, were interested at that time in being part of this. And so what we want to do is this. We want to go back to the municipalities and we want to say, this is what we want you to do. Just like you have a planning commission, just like you have an environmental advisory council, just like you might have a traffic commission, we want you to set up what I'm going to call tonight, but we won't be calling in the future, like a Blue Zones Commission, made up of people in your town who are interested in this idea. And the purpose of that is that those committees or commissions in each of the towns will then work with the new committee or council in BCHIP to implement these ideas. And in general, what are those ideas? I mean, Margaret went through a number of the things. I'm going to just break it down in very general terms. It's obviously going to be promoting healthier eating. It's going to be promoting getting out there, exercising. It's going to be promoting changing the built environment. Your question before about getting towns to build more bike paths. Almost every town, I'm sure just about every town in Bucks County, if not every town in Bucks County, has a plan to build those types of things. It's in their 10-year plan, I guarantee it is. The issue, of course, is funding, right? And one of the things that this new organization will help to do is identify, work with the towns, identify funding streams, and also identify alternatives where there are other ways that different communities can be connected that might be more cost effective, right? Margaret talked about other piece of built environment is finding public space. I think pocket parks are a great example of that. And those can be created in a lot of different areas. You know, we're here in Newtown Township right now. And one of the things about Newtown Township is it has a lot of clusters of developments. That's the way it developed over time. They're kind of hard to connect with each other. And so that idea of kind of the pocket park idea is a good one to start with, because that could be an easier thing to do, but then work on the piece of actually connecting them as well. So that's another piece, the built environment. Working on getting our food providers, our farms, our grocery stores, our restaurants, all those things that Margaret talked about, trying to work within each community to make those healthier choices available and to make it more mindful for people that happen. The big thing that actually was not so much in the Blue Zones report and was not really a part of the Blue Zones communities throughout the world because historically it wasn't an issue, is getting us back connected to each other as human beings. And putting these down, being more mindful of being in the moment and actually having human interaction. Now, I know I'm becoming like an evangelist on this, but I really feel strongly about this. You may know that I have sponsored the bill in Harrisburg to ban the use of phones in our schools K through 12 from bell to bell. And we got that bill out of the state Senate, and it's now in the State House, and the governor has said he will sign it if it gets to his desk. So I'm hopeful that's going to happen this year. But I'm citing that only because it's an example. It's an example of, you know, we need, not just the kids, but adults too, need to be more mindful about this and more connected to each other. There's so many mental health issues that arise from obsessive and excessive use of this technology. The technology is not, you know, it's not going anywhere, and it's not a bad thing. We just have to be more mindful about the way we use it. And so that has to be part of this program as well. I think we have to do it in the schools too, right? All of these things. One of the things we talked about when we did these visits 2 years ago was talking to the schools about getting the kids better educated in terms of nutrition, in terms of exercise, all of those things that this new organization can be part of. So I'm not going to go into it in more depth right now. The point of this is, if we're not going to do it through the Blue Zones organization because it's an expensive proposition and we don't have the resources to do that, we can still do it locally, because this is a great county. It is a great community. It's a great place to live, and it's that largely because of all of you, of all the people in the communities who have, over the decades, given their time and their resources as volunteers to make a difference in their communities. And this is yet another step on how we can do that. I look at Patrick Jones, I think about the community college. This is also another entity, like our different educational system, institutions in Bucks County, that can be part of this effort. So there's a lot that we can do. There's a lot we can do. And neither Kim nor I want to see this just fade away. And I don't think it will, because you're here tonight, more than 180 people here tonight, actually, because you're interested in this and you care about these ideas. And I know there were probably hundreds more who just couldn't make it here tonight who have that interest. We can really ignite something special in Bucks County, and I hope you'll be part of that. Kim.
Thank you. So we hope that you are leaving here tonight encouraged, most importantly, okay? The purpose of tonight was to share with you the results of the investment what we made in the investment we have made so far. So we've made an investment in this project, and we wanted to share the results of that research with you, and we were happy to do that tonight. There is a lot more detail that is available for you online. Margaret really just touched the surface. What is really important is that we want your message to also be received, that we want to be good stewards of our resources. And so that's what we are attempting to do. We are attempting to be very good stewards of our resources and utilize the resources of the folks in this room to bring this project forward at the most local level. So if you came here tonight looking for what's next, right? I want to do something, I want to move this forward, know that what we want to do that with you. And what BCHIP is looking to do, what I see our role in this project being, is really just being guidance. We want this to be led at the local level, but we want to use the science behind public health, where we're using evidence-based programs to do that. We're making sure we're getting the metrics that we need and measuring those outcomes on the back end to make sure that we can keep substantiating this work. That's what we see the role for BCHIP to be doing, and kind of giving the blueprint to this work, while it is really led by all of you at the most local level at your municipalities and your boroughs. So a couple things that I know that Steve's crew would be really upset with us if we didn't tell you. First of all, if you have any thoughts on a name for this project, I know we've only touched the surface, but some of you may have some very creative thoughts. If you have those thoughts tonight and you'd like to put them on a Post-it note, there is some opportunity for you to do that in the back. Or if you have ideas on that after today, there is a contact information up there that you can share. Also, if there is one priority, if you could pick one priority, and that's why we gave you the Post-it notes, that you felt was shared with you tonight, and if you have the urge to share more than one, you can, but if you had to pick one priority, what would that be that you feel we should be focusing on? If you're not sure and you need some time to reflect, you certainly can do so. We're available to be, and this is the beginning of this process, not the end. But we wanted to not miss the opportunity to ask you for your feedback tonight. So with that, I will throw it back to you, Steve, before we run out of time.
Thanks, Kim. We're going to open it to questions in just a minute. The last thing I want to ask of you is this. If you have an interest in being involved at the local level in a new, for lack of a better term, Blue Zones committee, let us know that too, okay? I'm not going to ask for a show of hands tonight. I'm not going to ask for any commitment like that tonight, but let us know, because that's going to give us a gauge too of which communities we want to start with where we know the interest is great. Because we're going to go back after tonight to all the municipalities, and we're going to say to them, hey, this is what we're doing. Do you have an interest? And this is these are the steps you need to take to set up this new commission and then go about that process of getting residents to volunteer and serve on those. If we have a list of people ahead of time who we know are interested in those municipalities, that's going to make their job a lot easier. We can provide that to them. And it's not a commitment, obviously. You can decide later that you don't have the time for it. If you don't want to do it, that's fine. But if that's a way that you can see yourself taking on a little bit more of a leadership role in this, that would be great as well. And look, if you haven't served on one of those local commissions or committees before, it's a great way to give back to your community. And it really is kind of a team effort. So it's not a situation where the burden falls on any one person. It's really everyone coming together and pitching in, which is what community is all about at the end of the day. Okay, so we'll ask for that as well. With that, I'm happy to open the floor to questions that you might have. Yes? And we're going to do the same thing with the microphone again.
Thank you. So I know that you went through a lot of different areas, and the Blue Zones have many more. To me, they all seem like they're very interwoven in the sense of creating well-being. And so I'm wondering two things. Number one, what their experience is if a community only takes one or two or three, but doesn't take the others that really are very interwoven, and also then how it is that you go about measuring the outcomes, because again, I know they have very vigorous, process. If in fact there are, pieces that are left out that again create that bigger picture of well-being for the community.
I'm going to let Kim talk about the measurement of efficacy. Let me answer the first part of your question, though. We will meet your community where it is. So whatever the local community is willing and able to do, we're going to support that and work with that. I'm hopeful at the end of the day it'll be all these things. But look, some of the things like the built environment, that's going to take longer, right? But this is going to be a further push to kind of make those things happen and maybe look at the plans in a new way. And working also with the county, we want to have the county involved. We've spoken to the county and the County Planning Commission about this too. We'll have further conversations along those lines. I think there's a lot that can be done to try to move things forward in that regard. Kim?
So Lisa, I really appreciate the question because you're right. If the theory behind Blue Zones is that it's comprehensive and we're only going to select pieces of it, then how are we going to measure the outcome? It's really what I'm hearing your question to be, right? I think that we have pieces of every part of their pillars that we will be able to implement. Maybe not not every slice of that piece of pie, but I think there will be pieces from the pie that will be comprehensive enough that we would be able to show a measurable impact. But that's with engagement from the community and buy-in from the community across the board in those things. And then we have to decide what we really want to measure, right? What is it we're looking to measure? Is it just that well-being score? Or maybe is the outcome we're measuring something as simple as what we're looking at sales receipts in grocery stores, and are we seeing an increase in selling healthier foods? So what do we want to measure? And I think that will be dictated at the most local level. So we'll see.
Other questions? Yes, sir, in the back. Hold on, we'll get you a microphone. Well, there's that too.
I've heard a lot of talk about the partnership between public and nonprofit and a lot of volunteerism, but I haven't heard much talk about conversations with the private sector. Other than Wegmans, who have you spoken to who might participate in this on a local level, because that's investment on a local level, because that's where third spaces are going to be built by private people, probably,
yes,
not by the government. So
right.
Talk about that a little.
So we had, sure. So during the assessment process, as part of our steering committee, we did have members of leaders in the private sector who were engaged in that. It was, Jim McCaffrey, for example, McCaffrey's Markets. There were others as well. That is one of the things, and Margaret mentioned this too, that we're going to have to work with in terms of, she mentioned a new kind of advisory committee in the county to work with our local employers to make workspaces more kind of a Blue Zone friendly workspace. That's something that's going to be part of our agenda as well. But we're going to have to, once we have this structure set up, we're going to have to then go out there and reach out to the private sector to get them engaged. Now, one of the issues we have in Bucks County is, we have some large employers, but not as many as some other places. A lot of people commute out of the county to some of the larger employers elsewhere. And so that was a challenge in terms of fundraising, frankly. But that doesn't mean we don't have private sector entities that we can bring in as part of this, and we'll do that as well.
Steve, you might want to also mention the YMCA.
Right, yes, I'm sorry, Rose, that's great. So Kim and I are very involved. So the YMCA is as well. The YMCA, under Zane Moore's leadership, is very interested in being part of this adventure and will be as well. So we're going to tie them in too. Other questions? Other questions?
Just for the record, we both missed Shannon doing the YMCA dance in the back of the room.
Was she doing that? She was trying to do that.
That's what she was doing back there.
You could come right up here, Shannon. Everyone would see you that way. Come on now. Yeah.
Steve, what is the probability of getting some legislature changed in order to get some blue zones? For instance, Philadelphia has cameras that they can use in order to catch speeders. Philadelphia has an additional sales tax on cigarettes. How do you think that could come to the local level, especially like speeding around the school zones, which is a big problem, I'm sure, in a lot of communities? Mm-hmm. And then the second part is bike paths. What is the probability of getting those on state roads?
Well, so first of all, with respect to any legislative change, I think we're better advised to do our local work. I would have to see specifically things that could be enacted that would make a difference. The difference that Philadelphia is a home rule charter city. That opens up a lot of opportunities that other, like a 2A county like Bucks is, doesn't have. And those types of changes to the system are things that happen over many, many years. So I would not want to spend a lot of time looking at that when we could actually be doing stuff on the ground here. In terms of state roads, we'd have to look at, from a municipality by municipality standard, a standpoint rather, what are the connections we're trying to make? And then once we see where there might be gaps that might implicate a state road or a state right-of-way, that's something we can address then. But I think we'd take that on a case-by-case basis. Okay? Yes?
Along that line, were there any kind of quick hits that came out of the report? The things that communities could focus on first to get to outcomes quicker?
Mm-hmm.
I believe so, yes. And so that was one of the reasons why I was so adamant that we couldn't just do the study and stop, because I do believe there is some what I would call low-hanging fruit that we can start accessing. Some of the restaurants are just banging down the doors to kind of get involved in this project and start making the healthier choice, the easier choice, and being acknowledged for that work. Some of the grocery stores as well. Some of the farmers, for instance, were very interested in trying to be more intentionally connected with some of the restaurants. So in doing the assessment, there was some natural connections that occurred that I don't want to see us let pass by. So while there are bigger lifts, like traffic patterns, right, or like making sure that we have the bikeability, and they are bigger lifts that's going to take infrastructure change, there was definitely some lower hanging fruit where I feel there's opportunity that we can be trying to start those little pieces at the most local level. Some of that connectivity piece that Steve and I are both so committed to, in just trying to bring resources that we have together already. In preparing for this meeting the other day, we were talking about shared interest in things, and we talked about shared interest in music. And I shared that I just attended an incredible concert, by the way, Dr. Jones, here Friday night, and that there's so many resources in Bucks County just for those that might have an interest in music. And this was just one tiny conversation around one topic. But how if you don't live maybe in that community or didn't get that mailer that you didn't know, right? And so how are we more intentional about making those connections? To me, that can also be some low-hanging fruit. And I'm really pulling in our county partners in that as well. So yes, I think so.
Right, and so the connectivity thing is a really good example of that. You know, what the Blue Zones organization refers to as MOIs, these community groups, you know, a walking group. That can be set up in any neighborhood, any part of any town right now. Mm-hmm. Having an organization to help foster that and make sure that we're getting people engaged is where this comes in and helps. The other thing is the intergenerational piece. When I was a township supervisor, I remember we felt, oh, these age-qualified housing developments, 55 and older, are a really great idea. And I hope I don't offend anyone here tonight who lives in one. God bless, they're beautiful. But I think we got to be working on bringing the generations together. One of the things that's clear about these blue zones around the world is they are strong because you have that intergenerational connection. Now look, historically, you had multi-generations living together. That has changed, as society has changed over the last 100 years or so. And even though it may not be people who are related to each other living closely, you still have multi-generations living in close proximity to each other. We have to try to pull them together. We have to provide opportunities where they can be together. And that's, again, I would describe that as a low-hanging fruit issue where we could work together in kind of foster that from happening. Yes.
Since you mentioned 55-plus communities.
Yours is one that I thought to create. So, go ahead.
But I did think about a couple of things with that. A good number of people who've moved into 55-plus communities have moved to be close to their grandchildren.
Yeah.
So you have that multi-generational effect. The other thing is you have relatively small pockets of government, 200, 300, 400, 700 people throughout Bucks County, these pockets. And generally, most are retired. Yeah, most. And they sometimes just want to do things. They want to help.
Right.
And if you're talking about helping the future generations, they're generally in. And it sounds to me like you could get groups of people, you could pull together every 55-plus community, bring them in here,
right,
and have a very large group of people who really might get interested in this.
Yeah, and
We hope
that's
so.
absolutely right. And let me give you one concrete example from where you live. If we had people in the Regency in Yardley into a community group or a MOI with people diagonally across the way in Yardley Corners, that's an opportunity potentially for that intergenerational involvement. And that's the kind of thing, but we have to be intentional about it, right? It's not going to happen on its own. So in some cases it does, right? In some cases you have people who take the reins, but I think this structure that we're talking about creating will help foster that. There was a question from the woman in the back, please. Yep.
You mentioned restaurants in the area were also interested in being involved. My curiosity is the people who are educating the restaurants, who is that source, considering you can say to put more vegetables, more fruit, for instance, on the menu, but if you're still ultimately using seed oils, which is a very large inflammatory food, and covering it in sugar, is that necessarily in the right direction in that? So I'm curious who the sources are for education.
So to be determined. So if we look at Blue Zones theories, we will be basing our work off of their theories or their science, right? So we are not going to be able to call these Blue Zone restaurants because we are not going to be adopting that policy, but we will be following probably some of the Blue Zone principles to me. That's what we'll be looking for because we're basing this project on that. But I'm going to be really honest, we have not gotten to that level of detail at looking at what those recommendations might be yet. So most certainly, someone with your expertise would be welcomed to kind of engage in that conversation so that we are looking at the right things.
Great, thank you. Other questions? Yes.
Hi, I have like a two-part. One's a statement. On the adverse side to your comment, I look around the room and I'm probably like the youngest one here and I'm like 30 years old. So I think a big initiative should be getting younger people involved because those are going to be the people who will probably benefit from this initiative the most. And then secondly, I'm not going to lie, I am feeling a a little discouraged that we're not securing the funding to go through with the Blue Zones name. But I think we're all here tonight because we all believe in this and we don't want to just like fall to the side and let this thing just fall through. So how can we like hold our municipalities accountable, and how can we get involved in that way? I know that we can all volunteer, or if we want, we can help spearhead some projects, but how can we actually hold people accountable in going through with this?
So, a great question, and you're right. We need to get a younger people engaged. We need to get people across generations engaged in this, right? We had a 3-month-old here tonight. And I think he was willing to sign up, but he was well past his bedtime. He had to go. The way you do that is by volunteering on that commission. If your town creates a Blue Zones committee or commission, then you get on that. And then you start the work in tandem with the organization we're going to put together at BCHIP so that we can actually start to implement this stuff. Right? And if you're getting pushback from your municipality, then you report that back, and then we can have those conversations to try to get past any impasse. I tend to think there won't be. I really think the only issue that's going to be difficult for a lot of towns is going to be the built infrastructure piece, right? And that's understandable, and that's where we're going to try to work with them to first figure out what's doable right now, and then ultimately explore other grant opportunities and things where we can help out to kind of foster all of that. But that's how you do it. We need you to be involved, and thank you for being here tonight.
Yeah, if I could just follow up there, like, am I responsible? And it's fine if so. Am I responsible to kind of form that Blue Zones coalition? Who do I go to? Do I attend a town hall? Maybe I'm.
You let us know. You've signed in tonight, right? You've signed in tonight. You let us know that you want to be involved. And then we have you on the list wherever you live to be a person who would then be someone involved there. And we will follow up with that.
But yes, if you want to take that to your local municipality or borough and start those conversations too, coming from all directions, both from Steve and I, and then from the people that live in their community, is not going to be a bad thing.
Yeah, right. Yep. You have agency, in other words, in this, right? And we're helping, but you also have agency, independent of us. Yep. Right here. Oh, I'm sorry, Rosa. Oh, Chio, go ahead. We'll come right back to you.
This isn't a question, this is more of a comment. And I just want to congratulate you not only for undertaking this in the first place, but also proceeding in a very practical way. I think no one should be upset that we're not going to use the Blue Zones brand, because you ought to recognize that Blue Zones is a big marketing organization. And it's a brand which has a lot of good stuff that goes with it, but they're in it to make money, and I think this is a real practical way to move forward in a way that is getting the community involved, because that's what it's going to depend on, is everyone getting involved and getting behind this effort.
Thank you, Chio. And I'll say, getting back to you guys, part of what has to happen here is getting that word out, especially because we're going to be having a different name for this. So just letting people understand what this really is. Now, there are, and we'll go into more detail of this down the road for those of you who really want to be more closely involved. There are things we can say, obviously, that this is inspired by this work. So there are ways that we can signal to folks what we're talking about. But the fact that we have to come up with our own name, okay, it's not optimal, but we can do it. And I'm sure at the end of the day, we have a lot of smart people in this room. We have a lot of smart people in this county. We're going to come up with something that's good, and I think it's something that's going to resonate with folks. So, thank you. Question right here.
Thank you. Well, first, thanks for holding this event. And I want to preface my question by saying I totally agree that the most important thing is community involvement and our own motivation to move this forward. But I did want to know, Margaret made it sound like Blue Zones had different tiers of participation, and that there was the full-on package, which was probably millions of dollars. but then that there's other tiers. And I wanted to know if any of those had been considered, and if they were off the table, was it because the value just wasn't there, even at those smaller levels?
Yeah, so what I'll say is this. The Soup to Nuts program was prohibitively expensive. And so that was just a non-starter. I mean, even if, as you know, what Kim described earlier with the condition of our hospital systems was different, it still would have been a stretch to try to raise that money. In light of that, we did ask them, well, what would be a more cost-effective approach? And they gave us some things, but even the lowest, the least expensive alternative was still pretty expensive. The problem was it really didn't cover much, at least not what we wanted to do. And so when Kim and I talked about it, we thought, you know, we could probably do more if we just try to do it ourselves. If we have a modest staff locally that could help, a paid staff. If we have this council or committee within BCHIP that would kind of oversee things, and then if we had these commissions in each town to be the local kind of node for this, we can probably do much more and do it much more cost effectively. So that's where we came out on it.
Just to elaborate a little bit, it was still several $1 million,
Yeah.
just to make, so there wasn't anything that was, and to be honest, that's not off the table. So I don't want anyone in this room to leave thinking we might never become an official Blue Zone. If we start building this and generate interest, and we have private funders throwing money at us to do it, heck, sign me up, let's do it, okay? But we didn't have that, right? In fact, we had everybody saying, wow, that's a lot of money when we have such competing priorities. That was the response from everyone across the board. Every funder we approached, that's a lot of money, okay? Even for the least expensive project, right? So I think we're hoping it's going to be one of those projects, if you build it, maybe it will come, and if not, still nothing bad's going to come from this. The work that we're doing here tonight, it might not be considered an official Blue Zone down the road, but there's nothing bad that's going to come from the conversations we've had here tonight, and by taking these results and moving them forward at a level that we have the resources to do now, and maybe down the road it will be more. So it's not off the table, it just wasn't appropriate right now. The timing just wasn't
Yeah,
right.
and let me add to that. What I would wonder about, even in the more traditional Blue Zone program, those programs, they function for about 5 years. And then the idea is the community is kind of makes it self-sustaining.
Yeah.
I think our model perhaps has a better chance of longevity.
That's true too.
Because if we're creating these local committees, and people will come and go and serve, you know, that's the other thing, by the way, on these commissions, you serve for as long as you can, and then other folks come in. So it's not like you're you know, tethering yourself forever to the position. But now you create a structure that can far outlive that. And I think it could have a greater impact long-term as a consequence. So we'll see.
Just to pick up on that,
Yeah.
a lot of hands went up when we said we watched the Blue Zones on Netflix, right?
Mhm.
Did everybody watch it
Yeah.
to the end?
Yes.
Well, then Blue Zone's not a great name, because the Blue Zones are shrinking. As the older generations that were being interviewed there, who are
Right.
90 years old, 100 years old,
Right.
the next generation was not following their lead. So
Right.
those Blue Zones are shrinking. I think we need a new name.
Yeah,
Ah,
thank you.
perfect.
Yeah, look, I think the important point is to really transform our communities and make them closer knit places where people live healthier lives and we're all together more. And I think that we can do. I really believe that. And I'm excited about doing it, which is why we're doing this meeting tonight. I don't want to see this, you know, go by the boards. Yep.
I'm just going to build on that and say I'm
Thanks.
excited too, and I didn't really I haven't had the time to really know what a blue zone is.
Right.
But this is a grassroots effort. That's how you're describing this, and it is exciting to see all the people in this room.
I agree.
If you're going through the municipality, get out there once we get a name, and you know we have a pitch. because that's what it is.
Right.
Which is great.
Right.
I don't quite have my arms wrapped around it yet, so I can't sell it to my constituents.
Right.
But absolutely support your local officials if that's the route we're going to, because there'll be municipalities where you're going to get pushback for reasons that really have nothing to do with what we're trying to do.
Right.
And so you really need to. I'm excited.
Thank you.
Leave here with the excitement that you have projected for us. But once you get started, just go to your township meetings once there's a program, a policy, whatever we're going to call it. But thank you so much for doing this, giving us the opportunity.
Thanks, Maggie. Appreciate that. And Maggie's a supervisor in Buckingham Township, by the way, so she knows what she's talking about now. Yes, sir.
Thank you. Thank you, Senator.
Sure.
I happen to live in a community that you visited in Regency at Yardley. In our township, and I don't think we're unique, we had a referendum, I think it was 2 elections ago, for the township to spend, I forget the exact amount, $15 million on open space. I don't believe they spent $1 on it. And it's going on 2 years. And I think that probably happens in more than our township, but I might be wrong. That being said, it seems like, and this again might just be our township, the zoning hearing board makes decisions that run against a particular Pennsylvania ordinance that requires for C3 land for all of these of 5 criteria to be met in order for a variance to be granted for a commercial property to be built. The zoning hearing boards can make any decision that they want to, it seems like. In fact, if they run right in the face of that particular ordinance. And that in itself is a little frustrating for those of us in our community who are trying to get the township to invest their money in open space and not look for additional tax money. That's all I have to say.
Okay. All right. Thank you. Yes.
One back here we haven't heard.
Okay. Yep.
Actually, 2 things. One, do you have the support from the faith-based institutions? Are they all interested and willing to come to the table and work with us? And the second is, how about Buck's Promise for it?
How about what?
Buck's Promise. For the name of the...
Oh, for a name. Okay. I thought that was another organization. We weren't aware.
It is.
So as far as the faith-based organizations are concerned, that was something that Blue Zones organizations talked about. We have had some discussions with them. We have not for this next phase yet, obviously, because we're getting off the ground with it. So, but it's not just faith-based organizations. It's going to be all the civic organizations in our communities, right? It's any organization that is part of the fabric of our community needs to be brought in and to be engaged. And again, that's work that a committee in BCHIP and even some paid staff can't do on their own. That's why we need the local help of people engaged in being part of those committees. Yes,
Steve, I think we only have time for
2
more
questions. Okay.
and then we have to wrap it up.
Yep.
So much. Thank you. Thank you for all of this. I guess 2 thoughts. One is just that it makes me so very sad, not necessarily that we're going a different route because the outcome might still be fantastic, but that monies can get raised in this country for things that are so hideously not important, and for something like this, it's difficult to get the funding as you try to. And it just, as a 75-year-old teacher, a college professor, worried about young people and my own young family members, it is just outrageous. But I'm curious about whether the person who gave us that very thorough assessment, the spokesperson for Blue Zones, is aware that this is the decision that has been arrived at and that we're not choosing to go with them. They've been informed of that.
Yes.
It's really kind of interesting under those circumstances that she gave that very thorough report to us.
So I do believe that we did pay we paid money for it, yes. We did that.
For that report.
But I also, but look, in fairness too, I will say that I do think that the people in that organization are dedicated to these outcomes. They're dedicated to spreading this kind of work. Yeah, it's unfortunate. I mean, the reason we're here tonight in April of 2026, when we started this process 2 years ago, is because we took a lot of time to try to find the funding. And we took a lot of time to try to find alternative ways that we could have worked with them to implement something meaningful. Unfortunately, it just was not a possibility. Yep. And one more question. Yes.
I just want to point out a resource that I want to make sure you guys are aware of. It makes perfect sense that you talk to healthcare systems in the area. But don't forget, there's a lot of healthcare practitioners that are outside of the healthcare systems. Many of us are already attached to local farmers and farmers markets. Many of us have huge number of patients who are interested in being healthy. So think about getting outside healthcare practitioners involved.
Good
appreciate
point.
that.
Thank you very much. I appreciate that feedback. Okay, so I think given the fact that it's nearly 9 o'clock, we're going to wrap up. If you would, please put your Post-it notes on those boards on the way out. If you have an interest in serving on one of these local committees that I talked about, please let us know that too. If you have some of the materials that you took on the way in, please put those on the tables on the way out. And please, please, please stay involved. We will have future public meetings to check in on where we are with these things. We really do want you involved, and we want to get this done. This is important work. So thank you all very much.